My name is Nikki Montgomery and I chose to talk about dietary supplements. More than one-third of Americans take multivitamins, which are a type of dietary supplement. While they are a popular complementary healing method, a 2015 study found that dietary supplements result in an estimated 23,000 emergency room visits every year in the United States. In this PowerPoint, we will examine what dietary supplements are, how they are used, and what patients should know before taking them. Dietary supplements are substances your body needs to function, such as vitamins, minerals, herbs, botanicals, amino acids, enzymes, and more. They are produced by companies in the form of tablets, capsules, powders, drinks, and energy bars for easy and efficient consumption. The idea is that these nutrients will supplement a diet that is otherwise lacking. In modern times, this is especially important as an increase in chronic stress and pollution levels increase the body's need for nutrients. However, more and more we are unable to get adequate nutrients for our food today as they contain more preservatives. Multivitamins are dietary supplement preparations that are used to increase nutrient intake, promote health, and reduce the risk of certain diseases. Taking a multivitamin helps people get the recommended amount of vitamins and minerals when they cannot meet those needs from food alone. However, taking a multivitamin places the patient at risk for getting too much of some nutrients, especially if they're taking more than a basic once daily product. Some people take a multivitamin as a form of dietary or nutritional insurance. Ironically, people who take multivitamins tend to consume more vitamins and minerals from food than those who don't. Multivitamins might be helpful in treating certain health problems, such as age-related macular degeneration. However, research has shown that healthy people who take a multivitamin do not have a lower chance of getting cancer, heart disease, or diabetes. Due to the limited research, it is not possible to recommend for or against the use of multivitamins to stay healthier longer. Dietary supplements do not replace consuming a healthy diet. Foods provide more than vitamins and minerals. They also have other ingredients, such as fiber, that have positive health effects. Some people may consider taking a multivitamin. These people include people who don't get enough vitamins and minerals from food alone, are on a low-calorie diet, have a poor appetite, or avoid certain foods, such as vegetarians and vegans. People with certain medical problems might be recommended to take a multivitamin by their healthcare provider. Dietary supplements allow these people to consume an adequate amount of essential vitamins and minerals. There are several limitations to using dietary supplements. The FDA regulations for dietary supplements are different, usually less strict, from prescription and over-the-counter medications. However, good manufacturing practices must be followed. The amount of scientific evidence on dietary supplements varies widely. It's very hard to determine the extent of the benefits of multivitamins and other dietary supplements on preventing diseases when so many other factors are involved. Dietary supplements should not be taken to treat a health condition. They may be prescribed to help supplement nutrients due to a health condition or to prevent a worsening condition. Additionally, supplements should not be taken in place of or in combination with prescribed medications without a healthcare provider's approval. Patients should always speak with their healthcare provider about their medications, as there can be serious drug interactions or side effects. Certain supplements should be discontinued before surgery, as they can increase the risk for bleeding. Natural dietary supplements do not necessarily mean safe. Natural products can still have negative effects in the body. There are several precautions regarding dietary supplements. Many dietary supplements include active ingredients that have strong effects in the body. For example, workout supplements and energy drinks. Dietary supplements can have serious side effects if taken with or instead of prescribed medication. Some supplements can increase the risk for bleeding or affect the reaction to anesthesia. Too much of one vitamin is a bad thing. Other than being an expensive waste, excess vitamin levels can increase the risk for side effects. For example, too much vitamin A causes headaches, liver damage, reduced bone strength, and birth defects. Pregnant and breastfeeding women need to be especially careful when considering taking dietary supplements, as many ingredients can cause harm to the baby. In general, it's always best to consult with a healthcare professional if one is considering taking a dietary supplement. As discussed earlier, dietary supplements can be beneficial to those who are not getting enough vitamins and minerals in their diet. If a patient has to take a multivitamin, there are several things that nurses must keep in mind. It is important that the nurse monitor lab values, as the supplementation of vitamins and minerals will increase certain values. If the patient receives too much of one vitamin, this can be detrimental. By monitoring the patient's lab values, the nurse ensures that the client's levels are within therapeutic range. It is equally important to assess the patient's adherence to the medication regimen. Dietary supplements only work if they're taken on a regular basis. The patient must be educated about the importance of adhering to the regimen. After a bit of time, the nurse must reassess the patient for the desired outcome and effectiveness of the desired dose. The nurse must know what the desired effect of the specific dietary supplement is. As discussed on the previous slide, it's important to provide good patient education. Oral tablets or capsules can be taken with water and with or without food. The patient should tell their healthcare provider about all medicines, herbs, non-prescription drugs, and other dietary supplements. They should also disclose if they smoke, drink alcohol, or use illegal drugs, as they can interact with the supplements. The nurse should stress the importance of maintaining frequent follow-up appointments with the healthcare provider to check on the progress of the dietary supplementation program. It should be explained that dietary supplements do not replace the need for good nutrition and a balanced diet. Symptoms such as a skin rash and difficulty breathing should be reported, as it can indicate an allergic reaction. Other severe symptoms such as vomiting should be reported to the healthcare provider. Less severe symptoms such as nausea and stomach discomfort are common. These are two questions I want to ask in order to highlight the important concepts regarding dietary supplements. The first question asks, how would you respond if a patient asks if it's safe to take dietary supplements? The second question asks, what are important things the nurse must educate their patient about when taking a dietary supplement? In conclusion, dietary supplements are manufactured to include vitamins, minerals, herbs, and plant products. They can be made from animal parts, algae, seafood, yeasts, fungus, and other food substance and extracts. They can come in the form of pills, powders, enzymes, energy bars, and liquid food supplements. Dietary supplements are used to supplement vitamin and mineral deficiencies when diet alone does not work. Some dietary supplements are formulated under careful conditions in clean, controlled laboratories and labeled correctly. Others are not. It's important to talk to your healthcare provider about starting any dietary supplement. Thank you for listening to my PowerPoint about dietary supplements. I hope you've learned a lot about why dietary supplements are beneficial to people's health, as well as the precautions and limitations. I'm sure you'll encounter a patient that is taking a dietary supplement such as a multivitamin, so it's important to be familiar with them. Thanks again.